Okay, so my background is actually emergency medicine. That's what I did my residency in New York, and I did it for 20 plus years. I loved it. I had a great opportunity to take care of a lot of people and see them at the worst time of their lives and being there for them at the bedside, and I enjoyed it tremendously. It was probably one of the best experiences of my life to work as an emergency doctor. I worked all over the state of Florida. I've worked a little bit in New York and Connecticut. However, as I got older, I was realizing that we were patching people up. We were doing the best that we could, helping people in dire need, in the middle of the night, having a heart attack and a stroke and having a catastrophe that we could help them through. And I felt like I did a great job with that. I'm so honored that I was able to do that. However, the more I thought about it, I was like, I want to get in the preventive side of medicine where I can prevent those 4 o'clock in the morning calls, a 911 that somebody's having a heart attack and a stroke. And I felt like not to downcast the medical system, I feel like I wanted to be more vigilant in helping people stay healthy. So as I was looking at my life, what my contribution to medicine was, and I realized that I felt like our patients were on a raft with no paddles, going down a meandering river, and at the end there was a cascade, a waterfall that was very dangerous. And I was like, you know what? I want to go upstream and catch them before they hit the waterfall, the cascade at 4 o'clock in the morning, which is, the cascade is the ER. It's turbulent, it's loud, it's scary. Bad things are happening all the time. And I was like, no, I want to go upstream. I want to go catch these people, give them a paddle, put them on a different route so they don't end up in the waterfall and go to the nice part of the river. And that's where my passion was ignited to do more integrative medicine, functional medicine, where I wanted people to get to the root of the problem, find out what happened, why did you become diabetic, what happened. Even looking at we start from the DNA level, we look at people's cells, what happened. There is something called epigenetics, like you were not born with a disease. Environmental issues, stress, trauma, exposure to different chemicals, a poor diet can lead to what they call tags on your DNA that leads to diseases. Having a genetic issue doesn't necessarily make you at risk for having the disease itself. It's not taking care of yourself and not having opportunities to change the path of the process. That's what leads to disease. So I wanted to get ahead of the game and be there for these people before they hit my ER at 4 in the morning, when they are in the cascade and the turbulent water and trying to survive, and in there with them, trying to pull them on the brink, out of the brink of death. So that's what it was.